I'm Dr. Nick Gates. I'm an orthopedic surgeon. I've been specializing in sports medicine and reconstructive surgery of the ankle and the foot for the past 18 years here at Commonwealth Orthopedic Centers. Today I'd like to talk to you a little bit about ankle arthroscopy. Arthroscopic surgery, simply put, is making small incisions on the front or the back of the joint, in this case the ankle joint, to place a camera inside that joint and then use another small incision to place instruments inside that joint to gain access for both diagnostic and treatment purposes. Ankle arthroscopy has come a long way in the past 20 years. We now have access to the entirety of the ankle joint, both from the front and the back of the ankle joint, and we can treat disorders such as loose bodies or cartilage damage, ankle sprains, and even ankle instability or looseness of the joint with arthroscopic techniques. The big benefit with arthroscopy in the ankle, as it is in the knee and the shoulder, is great access to the joint with minimal incisions. By making those incisions smaller and performing the procedure arthroscopically, there's less trauma to tissues, there's therefore less swelling and less pain. Those are all great advantages of arthroscopic techniques. Arthroscopy in the ankle is a specialized procedure that many ankle surgeons perform. I've been doing that here at Commonwealth Orthopedics for the past 18 years. Typically treated conditions include damage to the cartilage or scar tissue left over from previous ankle sprains. Cartilage can be damaged when an ankle is rolled either one time or repetitively. With arthroscopic techniques, we're able to isolate the area of damage to the cartilage. In the past, the most frequently performed procedure was to remove damaged cartilage to try to smooth out or trim out the area of damaged cartilage and try techniques to stimulate some growth of new cartilage in that area. Recently, there's been some great advance with cartilage restoration or cartilage repair. We now have the ability to not only remove loose pieces of cartilage that may be causing pain in your ankle, but also treat those areas of damage with cartilage graft to try to stimulate a new cartilage to form in those areas that's better, more reliable for the future and gives better long-term results. There are some cases of early ankle arthritis that we can treat with arthroscopic techniques. While an arthroscopic technique typically doesn't cure or completely remove arthritis, the damage that's associated with some early arthritic conditions, such as bone spurs, chips, or loose pieces of cartilage, can be treated effectively arthroscopically to help minimize pain, particularly associated with a course of physical therapy for the ankle. One of the other new techniques that's available is now arthroscopic surgery for pain in the back portion of the ankle. Historically, ankle arthroscopy was performed from the front of the ankle. It was the easiest and best access to the ankle joint. The one area that we did not have access to was the far posterior, or the far back side of the ankle. This is an area really where you might feel pain deep underneath your Achilles tendon. There is a structure in the back of your ankle that sometimes can break free or break loose that can cause kind of a nagging pain in the back of the ankle. We see this particularly in running athletes and particularly in competitive dancers who put their ankle through some range of motion and some stress that other people do not. There are now arthroscopic techniques to access that back part of the ankle and get the same benefits of the typical arthroscopic procedure, which is minimally invasive techniques, smaller incisions, and easier rehab. So if you're suffering from pain in either the front or the back of your ankle, sometimes an ankle arthroscopic technique is the right thing for you. This is Dr. Nick Gates, orthopedic ankle surgeon with Commonwealth Orthopedic Centers.